Friday, everybody. Dr. Peter Glidden here, steadfast advocate for health, welcoming you to November 15th, Friday, November 15th, live edition, 866-582-9933. That's 866-582-9933. Give me a shout, and I will talk to you live and in person. And if you're listening to the podcast and would like information, that number, 866-582-9933. That's the call-in number. It's 855-347, must be Friday, 855-347-3696. That's the podcast number, 855-347-3696, to get information about the health opportunity, about the wealth opportunity that we deliver here through the Agency of Longevity, bringing science-based, clinically verified holistic health solutions to the public. A boilerplate, one size fits all. Not really, but it's in that domain because we're in the power of busting myths. We are in the power of busting myths. That's what we do. What do I mean by that? Well, every culture has embedded inside of it a myth, a cultural myth. And the cultural myth is reality by consensus. It's reality because everybody agrees it's reality, but in point of fact, everybody's wrong. Slavery was a giant cultural myth. Oh, those African Americans, those blacks, they're not really people, they're just animals. Well, that's how slavery was justified for, 600 years? Everybody was wrong. Then everybody thought the earth was flat. Well, before that, during that, everybody thought the earth was flat. Everybody's wrong. Before that, everybody thought it was the earth that was at the center of the solar system. Everybody's wrong. After that, in this country, I think as little as, 60 years ago, women didn't have the right to vote? Oh, those women, they're not smart enough to vote. Everybody was wrong. There are a number of cultural myths that are embedded deeply in the fabric of our society now. And the thing about a cultural myth is you don't know that it's a myth when you're in the middle of it. It's like the Matrix. You don't know that it's a dream. You don't know that it's all made up. You don't know what you don't know. And in this case, you don't know that it's reality by consensus. And the single biggest myth that we are beneath the wheel of in the free world, the less than free world, the relatively free world, that's a better way to say it, the relatively free world, is the notion that the MD is the absolute owner, king, champion, emperor of the domain of medicine. I mean, after all, they coined the term MD. They're the medical doctor. Everybody else is what? An alternative medical doctor? Well, that's convenient for them, and honestly, it was a stroke of genius, a stroke of marketing genius. Whomever came up with the designator MD to represent the allopaths. Now remember, right, in the wonderful world of medicine, there are many different points of view. You've got the allopathic point of view, which is the MD point of view. You've got the naturopathic point of view, which is my view. You've got the chiropractic point of view. You've got the homeopathic point of view. You have the acupuncturist point of view. You have the Chinese medicine point of view. You have the Ayurvedic medicine point of view. You have the herbal medicine point of view, and they're all different in their understanding of the nature of disease and the treatment thereof. If you want your head to explode, go see a traditional Chinese medical doctor. Go see a traditional Chinese, someone who practices traditional Chinese medicine and is licensed as an acupuncturist and is versed in Chinese medicine. The diagnosis of illness from a Chinese medical point of view is in a language that you can't even understand. Too much yin energy, too much yang, a wet spleen, a heavy triple burner. This is the language that the traditional Chinese medical doctors bring to bear, and their understanding of the pathogenesis of disease is radically different from the understanding of an MD or a naturopath or anybody else, because we all bring to the table a different set of filters, a different lens through which we observe what's happening to a human being and do stuff about it. This is called the practice of science, the practice of science, the practice of medicine in this regard. So, you know, the MD doesn't practice medicine. The MD, nobody does. Medicine's gigantic, huge, vast terrain. MDs don't practice medicine. They practice allopathic medicine. Now, whoever started calling them medical doctors was brilliant, because it convinces everybody in the world that, you know, they're the medical doctors and everybody else is an alternative medical doctor, which is like calling a Great Dane, now the Great Dane, that's the only real dog and every other dog is an alternative dog. Well, that's nonsense. You wouldn't do that. But that's exactly what we do with medicine, because we don't know any better. Why don't we know any better? Because the pharmaceutical industry has convinced us that the MD is the king and that there is, in fact, nobody else sufficient to the cause. And the legislative bodies of the states walk in lockstep to the purview, to the declarations of the Food and Drug Administration and the American Medical Association. So they have allowed the MDs to legislate themselves into first place. It may interest you to understand that in the mid-'80s in the United States, the American Medical Association was found guilty in federal court of racketeering, and they were promoting false propaganda on purpose against the chiropractors for 10 years. They were telling their members of the American Medical Association to tell their patients that chiropractors were dangerous, had substandard training, were quacks, and should be avoided at all costs. They were convicted of, whatever this is called, racketeering, slander, I guess. Slander, I guess, would be the best way to describe it. And against the chiropractors, and the federal government ordered the American Medical Association to pay $25 million in fines, which is a drop in the bucket to the AMA. So was it worth $25 million to the AMA to have 10 years of propaganda convincing people not to go to the chiropractor? Of course it was, because it's a giant numbers game. Medicine is all about money here in the United States. So if you can keep people from going to the chiropractor, they're going to need their MD more and more and more and more and more, because remember, chiropractors actually fix things. Naturopathic doctors actually fix things. Homeopathic doctors actually fix things. Acupuncturists actually fix things, but the MDs manage things. It should be against the law for a hospital employing MDs exclusively as primary care medical providers to advertise that they practice health care, because they do not. They practice disease management. And if we started putting signs on the side of hospital, disease management, instead of health care, fewer people would go, or more people would question what they were getting into before just automatically getting into it. But we don't do that. That's not going to happen, because they've cooked the books, they've stacked the deck, they have made it nearly impossible for other members of legitimate, licensed and regulated medical professions like the chiropractors and the osteopaths and the homeopaths and the MDs to compete. My profession, naturopathy, we've been trying to get naturopathy licensed in Massachusetts for over 20 years. We got nothing. We've been trying to get the state of Illinois to license naturopathic medicine for 10 years. We've got nothing. And, you know, we're only licensed and regulated now in 16 states, which is pathetic. Pathetic when you think about it. And this really is the reason that the MDs don't want competition, is because they know that if there was competition, if there really was a free medical market, they'd be out of a job, and they would be, and they know it. Well, I'm not sure if they know it. Somebody knows it. In any event, monopoly is a good thing for the people who hold the monopoly. It doesn't matter what the industry is. If it's monopolized, it's a really pretty great thing for the people in the majority, which in this case is the allopathically trained MDs. And what do we get when we're involved with a monopoly? Well, we get corruption. Number one, the Food and Drug Administration is members are not elected; they're appointed. A third of the MDs who work at the FDA and whose job it is to make sure that the drug companies are doing the right thing and okaying drug use for the American public. They're the overseers of the medical marketplace. One-third of the MD members of the FDA have financial affiliations with the drug companies that they're regulating. And the general public doesn't know this. We wouldn't accept it if we did. We wouldn't put up with it if we did. But that's how they get away with it because, again, they've stacked the deck. Vioxx kills 500,000 people. Nobody goes to jail. Vioxx kills 500,000 people. Nobody goes to jail. I read on the Internet last night that there was a number of cases of acute liver failure from a weight loss supplement, number of cases of acute liver failure of a weight loss supplement, I think in New Mexico or Arizona or someplace. It was front page news. Oh, the nutritional supplement industry needs to be regulated. Meanwhile, the single number one cause of acute liver failure is Tylenol. Tylenol is the number one cause of people's livers failing and them needing to be rushed to the hospital because they're going to die. Tylenol, acetaminophen, the number one cause of liver failure. And you never hear about it. It's never front page news. Stop taking Tylenol. Stop seeing your MD. Because we're in the middle of the medical myth. You want to pop out of it? 866-582-9933. Going to talk to Danielle in Pensacola when we come back. I am Dr. Peter Glidden. Stick around. If you want a different outcome, you need a different way. A fool, of course, is someone who does the same thing over and over, expecting a different result. So people go to this specialist or that specialist or the best cardiac surgeon in the world or, the George Bush's doctor. Oh, yeah, they're the best. Well, maybe, but it's MD-A, MD-B, MD-C. It's all inside the same world of allopathic medicine. So you're going to get the same stuff, different flavor from allopaths. You're going to get the same stuff, different flavor from the allopaths, no matter which one you go to, no matter which specialist you go to, no matter how much clinical experience they have. They all believe that the human body is a coincidental amalgamation of biochemicals that started in an antediluvian Jurassic Park swamp thousands of years ago. There is no soul force. There is no inherent healing ability of the body. There is no innate intelligence to the machinations of the human body. Once you're sick, you're screwed. It's the doctor's job to jump in and manage your symptoms, to outsmart nature, to orchestrate a hostile takeover of your biochemistry with drugs and surgery. That's what they're trained in. That's why you should fire them. Because that point of view is ridiculous on its face. It's old-fashioned, it's outdated, it's archaic, it's Machiavellian, it's monopolistic, it's profiteering, and it just plain doesn't work. Now, look, I got no problem with making money at all. But, when you monopolize an industry, you can do whatever the heck you want and get away with it, even if it doesn't work, which is why the MDs are still in first place and why everybody in the freaking world needs to fire their medical doctors. The only thing you need them for is trauma care and a handful of infectious diseases. But remember, Harvard University says that over 50% of emergency room physicians are addicted to street drugs, prescription drugs, or alcohol. So if you do have to go to the emergency room, heaven forbid, have your doctor drug tested before you let him lay his or her hands on you and see what happens. 866-582-9933, 866-582-9933. Give me a call and let's chat. like Danielle in Pensacola, Florida did. Hey, Danielle, thanks for the phone call. You are live.
Hello.
Hey, Danielle, come on in. What's going on?
I just wanted to ask a question about pregnancy. I'm 3 months and 2 weeks pregnant, and I just noticed that I've been getting a lot of food cravings and, like, headaches. So it makes me feel like my body is kind of, like, lacking vitamins. And, like, with one baby, you can tell one of my babies are, like, really big. It's really big, so you can tell it's getting, like, all the vitamins and nutrients that it needs to get. And the one is really small. So I was just wondering if there's anything in particular, any vitamins that I could be taking.
Well, that makes you the smartest girl in Florida. I mean, you're absolutely right. And there's a couple of things going on here, right? From our point of view, which is science-based, clinically verified, licensed and regulated medical nutrition, delivered through a holistic view, 100% of birth defects, that's everything, including autism, are caused by nutrient deficiencies. So, for instance, we believe that Down's syndrome is a zinc deficiency. We know that cystic fibrosis is a selenium deficiency. We know that muscular dystrophy is a selenium deficiency. We know that spina bifida and cleft lip and cleft palate are vitamin B-like baby deficiencies. It is our fundamental belief that starting at the moment of conception, the developing child inside your body is craving, needs raw materials in order to grow, right? I mean, you can't make a baby out of fairy dust, right? You need vitamins and minerals and amino acids and essential fatty acids. And the stark reality here, Danielle, is that there are, from our point of view, which is researched and clinically verified, there are 90 nutrients, essential nutrients, that your body needs to function properly every day. There are 90. 60 minerals, 16 vitamins, 12 amino acids, and 2 essential fatty acids for a total of 90 essential nutrients. The problem is, it is impossible to get all 90 essential nutrients from food, no matter how good your diet is, no matter how clean your diet is, no matter how many calories you eat every day. It is impossible to get all 90 essential nutrients because the nutrients are not in the food. They're not all in the food. Some are. So you must supplement in order to keep your body healthy. And when you're pregnant, you have to do a little bit extra because you're feeding 2 people. Stick around, Danielle. We're up against a hard break. When we come back, I will tell you exactly what you need to do to have a super baby. I'm Dr. Peter Glidden, folks. This is Fire Your MD Now. Listening to the podcast, thank you very much. 855-347-3696. That's the number to call to speak to a living, breathing human being. 855-347-3696. Let's go back to Danielle in Pensacola, Florida. Hey, Danielle, are you still there?
I'm still here.
All right, thanks for hanging on. So, how much? What's your current body weight right now?
My body weight right now, because I gained a lot of weight during my pregnancy, I would say it's like 305.
Okay, so the recommendation for you in a perfect world would be 3 healthy start packs, and 4 bottles of selenium a month. 3 healthy start packs and 4 bottles of ultimate selenium, S like Sam, E, L like Larry, E, N like Nancy, I, U, M, selenium a month. If you can't afford that, do 2. If you can't afford that, do 1 healthy start pack and 1 bottle of selenium. That is the absolute minimum that you need. 1 healthy start pack and 1 bottle of selenium a month. I would also, if you're going to drop down to the lowest, which is way better than doing nothing, I got to tell you, Danielle. So the minimum program that I'd like to see you on is 1 healthy start pack, 1 bottle of ultimate selenium, and 1 bottle of plant-derived minerals a month. 1 bottle of plant-derived minerals a month. Now, you know, it's interesting here because your body has wisdom. Our whole fundamental position here is that your body has wisdom. And craving foods during pregnancy is a direct aspect of the wisdom of your body, because your body knows that it needs stuff. So it makes pregnant women have crazy food cravings. I was given a lecture in Montana, I think, 2-3 years ago, and it was a bit, I don't know, there must have been 250 people in the lecture, and I was telling people all about the relationship between nutrients and appetite and cravings and stuff, and a woman in the back of the room raised her hand. And she said, "Doc, I've never told anybody this, but you're absolutely right." She said, "I grew up on a farm, and when I was pregnant, I used to sneak out of the house in the middle of the night and eat the dirt that was underneath this one oak tree on our property. I was driven to do it, and until I came to this lecture, I didn't know why." So you got to listen to your body. You're smart enough to do that. And I got to tell you something, Danielle. When you give your body the nutrients that it needs, you know, the stuff that's not found in food, it's a game changer, man. Everything changes. Your appetite gets better, your mood gets better, your weight gets better, your sleep gets better. Everything brightens up because your body's nutrified. It's a really great thing. By the way, how did you find out about this radio show?
Because of my friend, Irma Granat. Yeah, I'm putting her name out there, but she's the one who told me about the show. Yeah. All
right, great. So talk to Irma, and she'll tell you how to get these nutritional supplements at the wholesale price. And if you're interested, have a little extra time on your hands, she'll also show you a way that you can get $200, $300, $400 worth of nutritional supplements a month for free, or even make a little bit of extra money every month by helping people in your world to recover their health. And that's what we do. There's 2 ways you can work with us. You can just be a customer, ask us what to do about whatever, and we'll tell you what to do, and you try it, and you see what happens. And most of the time, it's only good things that happen, because this is the best medical nutrition in the world right now. It's developed and delivered by licensed and regulated holistic physicians, and nobody else has that. Nobody else has our level of expertise. This stuff rocks, no kidding. And if you feel so inclined, you can join us. You can join Youngevity as a member, and when you turn other people onto the Youngevity nutritional strategies, we'll pay you to do it. I mean, that beats a poking the eye with a sharp stick. So talk to the person that invited you here, that told you about this radio show.
Right.
Get her done, Danielle. I appreciate the phone call. Thanks so much. Give me a call back after the baby's born. And by the way, Dr. Glidden is a most excellent name for a baby. From Florida to Pennsylvania, must be Friday, right? Let's talk to Gwen about blepharitis. And there's a word that you don't hear often. Hey, Gwen, thanks for the call. You are live.
Thank you, Dr. Glidden. I have a few things, and it's mostly with the eyes. The first thing is the blepharitis. I heard you once say, because I'm a loyal listener, of course, that you've told somebody to take the colloidal silver in an eye cup for 72 hours, to do it 3 times a day for the blepharitis. I tried that, and it really hasn't helped. It's really swollen. It almost looks like the eyelid is, on the upper eyelid, it looks like the skin on top, it looks like it's starting to sag. Yeah. And it looks like it's also, like, misshapen, I guess, from chronic inflammation. Excuse me. And also, there's a dandruff that I tried cleaning with the baby shampoo, and it really doesn't help, and it's really annoying. Also, I have to say that I was diagnosed with Sjogren's syndrome.
Yeah.
And I've been noticing for probably the last month, I've been having a lot of tingling on the right side by the temporal area. And it also feels like it's cold inside. And there's also, today I really felt like it was burning inside. Like if you cut yourself and it's like burning from the inside.
Well, what part of your body feels like it's burning from the inside?
By the upper eyelid. I think it's called the supraorbital margin. It's around there.
Well, that makes you the smartest girl in class. What do you do for a living?
I'm into retail.
Oh, yeah, okay, good. Well,
yeah, but I have a big passion for health, too, so I look up all the diagrams, and I'm like, maybe this will help out a little bit.
Yeah, so are you an insider with my webinars?
No, I'm not, but I'm thinking about going for it.
Well, look, check it out. If you're like a medical maven and you look all kinds of stuff up all the time, I'm going to give myself a pat on the back here. I really am, because this is my strength. My strength is being able to describe to people really seemingly complicated metabolic, physiological processes and just make it easy to understand, because in point of fact, it's all easy to understand. The MDs have just complicated it ridiculously in order to make themselves seem intellectually superior to everybody else. It's $20 a month. You can cancel at any time. So become an insider for $20, and with a one-time, $20 for 1 month, you'll have immediate access to all of my archived material. I've got over 100 hours of webinars in the library about Sjogren's syndrome and thyroid health and detoxification and lupus and Lyme disease, and you name it, I've got it. And, if you don't like it or it doesn't seem to fit the bill, then you can cancel at any time. And in the worst case scenario, you're out $20. But you're going to love it. And honestly, we also have, as an insider for $20 a month, you have access to 4 hours of live webinars every week, 4 hours of live webinars every week. So check it out. I think you're going to be pleasantly surprised. There's a homeopathic medicine which I'd like you to give a try to see if it can't help you get on the other side of the blepharitis. How long has the blepharitis been present, by the way?
I'm probably going to say for 6 months, and it's getting worse.
Yeah. Has this happened to you in the past?
No, it has not. I don't know what's going on with it. And now I'm getting like pain on the up, and the tingling is driving me crazy too.
Yeah. Was there anything going on in your life immediately before it happened?
No, but I did fall on my face, and there was the same exact spot that I fell on from a chair.
Okay, very good. So, do you see a chiropractor?
I used to see a chiropractor, but now I see somebody that deals with orthogonal treatment. They really don't do cracking; they're more like massaging. Yeah,
well, I would go. So here's what I would do.
Okay.
Because right, we don't want to complicate things, and we don't want to overlook the obvious, right? So most of the time, when there's an instigating event, and then after that instigating event, we've got chronic and persistent symptoms, then the instigating event probably had something to do with it. So for goodness sake, you fell on your face, and the part of the body that you fell on now has developed chronic problems, right? So a smart thing to do would be to find someone who's versed in craniosacral manipulation. Craniosacral manipulation. Have you ever heard of that before?
Yes, I have.
Ever done it?
No, actually, I was also, that's on my to-do list.
Well, put it to the top of the list, because, there's a number of bones in your skull and in your sinus cavities and in your head, and they all fit together like pieces of a jigsaw puzzle. It's a very kind of fluid situation. It's not the hard, bony, petrified thing that you see in the Mr. Skeleton hanging in the high school class. It's quite different from that. Living bone is quite a remarkable thing. So I would go to a craniosacral therapist, tell them exactly what happened, tell them exactly what your symptoms are, and see if they can't help you with physical medicine, physical manipulation to that part of your head, number one. Number two, I'd like you to give a homeopathic medicine a try, and it's called Glidden. L like Larry, E like Edward, D like David, U, M like Mary. Now, all homeopathic medicines have 2 names because it's a Latin designation. The complete name of this medicine is Glidden palustre, but you don't need to worry about the second part because there's only one medicine in the homeopathic armamentarium that has Glidden at the beginning of it. So just find a homeopathic Glidden, L like Larry, E like Edward, D like David, U, M like Mary, in the 200C or the 200CK strength. 200C or 200CK. If you can't find it locally, you can order it by a company called Homeopathy Overnight. Their number is 800-276-4223, 800-276-4223. If you do order it through them, tell them you want one multi-dose tube of Glidden in the 200C or the 200CK strength. And when you get it, however you get it, sometimes you can find this at Whole Foods, by the way, in the 200C strength. I'd like you to take 2 pellets 3 times a day for 3 days. Have you ever taken a homeopathic before?
Just a nasal spray for allergies.
All right, so this medicine is going to show up in a small tube. It's going to look like a lipstick container, kind of, sort of. And in the tube, there's going to be about 100 little white medicated pellets. They're each about the size of a BB, about half the size of a lentil. The recommended dose is only 2. 2 of those pellets on the tongue, just suck on it like a Tic Tac. 2 pellets orally 3 times a day for 3 days. See if that makes a difference with the blepharitis. Now, have you eliminated the 10 bad foods?
Yes, I have, except I was eating a lot of Indian food once a week, and I didn't realize that it had so much oil in it.
Yeah,
so
it's crazy.
I eliminated that.
All right, good girl. It's crazy oil. And you're taking the Healthy Start Pack and selenium? I
have the Healthy Start Pack, and I take between 3 to 4 seleniums a day.
And how much do you weigh?
I weigh 110.
For 7 days in a row, take 12 selenium a day. For 7 days in a row, take 12 selenium a day and continue to do the colloidal silver eye wash for those 7 days. How
long should I leave it in for?
Oh, just, 10 seconds, 10, 15 seconds.
With the eye cup?
Yeah, with the eye cup.
Okay.
10, 15 seconds to each eye. Check it out and call me back. Sjogren's syndrome, that's an interesting thing. I don't think I've ever talked about that on the air at length. I'm going to talk about that on air at length in the second hour, so stick around. Sjogren's syndrome, everything your MD did not tell you about Sjogren's syndrome, coming up in the second hour right now. What, do you hear something? What is that? Aloha, oe, aloha, oe, aloha. We're going to go talk to Sharon. Guess where she's calling from? All the way from Hawaii. Sharon in Hawaii. Mahalo, aloha. You are live.
Oh, thank you. Thank you, Dr. Glidden. The diagnosis from the MD is hemorrhoids. Now, this is my son I'm talking about. I spoke to you briefly on the phone.
Yeah.
So what I'm kind of concerned about is the prescription. Meanwhile, until I figure out what to do with longevity. So he has a stool softener over the counter.
Yeah.
And the other one is the one I'm concerned about. It's a suppository that has steroid in it.
Yeah, well, see, that's all they do. If you took steroids away from the MDs, they'd be out of a job. I mean, they wouldn't know what to do because they throw steroids at everything. And see, the rationale, the reason that they do this is because they actually believe that the human body is like a train wreck, right? MDs actually believe that heartburn is an evolutionary mistake, that the human body just evolved with too much stomach acid. Too much stomach acid is a part of the natural human condition, and it's therefore the doctor's job to eliminate stomach acid with their drugs, and it's insane. It is an absolutely insane point of view, and yet heartburn medication is the number 2 most prescribed medication in the United States because MDs still think like this, which is tantamount to a medical doctor telling you that your arthritis is caused by possession by an evil spirit from Mars, right? It's nonsense. It's completely ludicrous, and yet they prescribe Prilosec and proton pump inhibitors like candy, and nobody ever questions their point of view. And if the medical doctor ever told it like it really was, people would run away screaming from them, horrified. It's no different with steroids. Because, steroids are anti-inflammatories. They're anti-inflammatories. Virtually every illness in the human body has roots of inflammation. Inflammation is associated with virtually every illness, so The MD's rationale is they have no idea what causes the inflammation. They don't care what causes the inflammation because from their point of view, the human body is a train wreck waiting to go off of a cliff, and crap just happens. Just happens. We can't ever figure it out. It's all genetic. It's all too complicated. We'll never be able to figure this out until we have a super-duper worldwide supercomputer. Then we'll be able to figure it out, and then we'll be able to genetically manipulate you so that you never, ever have a stomach or whatever. It's nonsense. So, because everything is rooted in inflammation, they throw anti-inflammatories at everything, and sometimes the anti-inflammatories knock down the inflammation. Sometimes they don't. But when they knock down the inflammation, they never ever get to the root of the inflammation. So you take the anti-inflammatories, the inflammation gets better for a little while, you stop taking the anti-inflammatories, guess what? The inflammation comes back, but it always comes back worse. And they're insane. They're nuts. Now, anti-inflammatories sometimes, when used judiciously, can be beneficial. Remember, it's not the gun, it's how it's used. It's not the drug, it's how it's used. 7 days max for the anti-inflammatories. 7 days max. Do not do them for longer than 7 days. And when he's taking the anti-inflammatory suppository, have him eat tons of eggs. Eggs and butter, full-fat milk. He needs to load his body up with cholesterol. Load his body up with cholesterol and B, like baby vitamins, B vitamins. In the perfect world, he'd be doing the Healthy Start Pack, while the anti-aging Healthy Start Pack and selenium appropriate for body weight, and he'd be eliminating the 10 bad foods. That's in a perfect world. You may also want to give a homeopathic medicine a try. Collinsonia, homeopathic Collinsonia, Collins, like Sam, O-N like Nancy, I-A, Collinsonia. 2 pellets 3 times a day for 3 days. See if it helps, and give us a call back. Ladies and gentlemen, Sjogren's in the second hour.